State Medicaid offices target dead people's homes to recoup their healthcare costs. As Salvatore Legrand fought cancer and all the pain that came with it, his daughters promised to keep him in the white, pitched roof house he worked so hard to buy all those decades ago. So Sandy Legrand thought it was a mistake when, a year after her father's death, Massachusetts billed her $177,000 for her father's Medicaid expenses and threatened to sue for his home if she didn't pay up quickly. The home was everything to her father, said Legrand, 57. But the bill and accompanying threat weren't a mistake. Rather, it was part of a routine process the federal government requires of every state to recover money from the assets of dead people who in their final years relied on Medicaid, the taxpayer-funded health insurance for the poorest Americans. A person's home is typically exempt from qualifying for Medicaid, but it is subject to the estate recovery process for those who were over 55 and used Medicaid to pay for long-term care, such as nursing home stays or in-home health care. Critics argue the program collects too little, roughly 1%, of the more than $150 billion Medicaid spends yearly on long-term care. They also say many states fail to warn people who sign up for Medicaid that big bills and claims to their property might await their families once they die. Legrand says that's how she ended up in a 2-year legal battle with Massachusetts after her father died. Several years before he died in 2016, she had turned to a local nonprofit for advice on caring for her elderly father. The group suggested she sign him up for Medicaid. She even remembers asking about the house, but was assured the state would only seek the house if it sent her father to a nursing home. She says it wasn't until after his death, when the state's demand for $177,000 arrived, that she saw the first bill for his care, which included a brief stint in the hospital for pain from cancer, medications, and hospice. Some states will put a lion, a legal right, on a home while others don't. Meanwhile, some Medicaid offices try to recoup all medical costs from patients, like doctor visits or prescriptions, while others just pursue the costs for long-term care. New York and Ohio topped the country for such collections, recovering more than $100 million combined in a single year, a Dayton Daily News investigation found. An investigation into the Kansas program released Tuesday by the Health and Human Services Inspector General found that program was cost-effective, yielding $37 million while only spending $5 million to recover the money, but the state didn't always collect the money from estates that were eligible. Last month, a foundation for one of the industry's biggest health insurance giants called on Massachusetts to overhaul its process, which includes collecting reimbursement for most Medicaid costs beyond the federal government's minimum requirement to recover long-term care expenses. Estate recovery has the potential to perpetuate wealth disparities and intergenerational poverty, said Catherine Howitt, a Medicaid policy director with the foundation. In Tennessee, which recovered more than $38.2 million from more than 800 estates last year, Imani Mafalme found herself in a similar predicament after her mother's death in 2021. Now, Tennessee's Medicaid office says she owes $225,000, and the state is seeking a court order that would require Mafalme to sell the house to pay up. TennCare, Tennessee's Medicaid office, said in an email to the Associated Press that it would not comment on specific cases. Earlier this month, Democratic Rep. Jan Schakowsky of Illinois reintroduced legislation that would end the federal government's mandate. Schakowsky believes the rule is a losing proposition for families who give up their homes and taxpayers who don't see big returns from the recovery efforts. In a gridlocked Congress where some Republicans are clamoring to trim Medicaid entitlements, the bill is unlikely to garner the bipartisan support needed to become law. Many people don't know about the decades-old mandate, which was intended to encourage people to save for long-term care or risk losing the equity from their home, explained Stephen Moses, who now works for the conservative Paragon Health Institute. The plan here was to ensure that people who need long-term care can get it, but that you plan ahead to be able to pay privately so you don't end up on the public health care program, Moses said.